So you've had a total knee replacement and you're in physical therapy. The question is, how long are you in physical therapy for? How long do you plan on going to physical therapy? For me, I was in physical therapy for just over 4 months, 18 weeks. Now, I did have both my knees done at the same time. And quite honestly, those first 8 weeks, I was doing all the things they told me to do, but it really wasn't until I hit like 10, 12 weeks that my body actually started making better progress. I think the trauma of the surgery just honestly slowed me down a little bit in the beginning. But how long can you expect to go to PT? I hear from a lot of people 8 to 12 weeks is kind of considered normal. I could not imagine stopping PT at 8 to 12 weeks. I felt like I had so much more progress to go. But obviously I'm not a PT, but the way that they know if you're ready is if you can do your DLA, like your daily, is it DLA, DAL, daily activities. Once you can do your daily activities with minimal pain and you get your bend and your flexion, you're done. I was not ready to be done. I was not ready to be done at all at 12 weeks. I was just starting, honestly. But that's a great question. And I think too, if you're considering a total knee replacement, it's really important to ask your physical therapist questions like, do you work one-on-one with the patient? Do you work on several patients at one time? Like, what's the style of the practice? What can I expect when I come in? Do I need to warm up before? Those are all, I've had a lot of different experiences with different PTs for over the years, like with different surgeries. And I will say that there's a lot of differences out there. So it's important to ask those questions that you don't think about before. Another question I wish I would have asked that I didn't ask is how, and I don't know, could a PT be, that's their whole thing is knee replacements? Or is that not a thing? I don't know. I wish I would have asked how many knee replacement patients their experience was with knee replacement patients. My physical therapist was great. I was her first bilateral total knee replacement patient. I guess she learned a lot from me, but then sometimes I wonder, maybe I should have looked into someone who specialized in that. Perhaps I wouldn't have had to go for 18 weeks. Maybe I would have, with their experience and knowledge, maybe I would have gone less. I don't know. Anyway, at the end of the day, I had a good experience, but I think there's a lot of questions to ask about PT. So if you are in the TKR club, how long did you go to PT? How long do you plan on staying in PT?